You learned a lot while you were in Washington.
I sure did.
It's commonly believed now that the atmosphere is so vituperative, so venomous, that even when an outstanding appointment is made, I worked in Washington for 10 years during the 60s and 70s. And at that time, someone of your qualifications, background, recommendations from all sides of the political equation, to say nothing of medicine itself, would have sailed through. Why didn't it with you?
I don't know. The old timers in Washington told me what you said, which is they'd never seen quite so much polarization. And my experience was that when we were in the midst of debate, when I would be with a Republican senator talking about issues, didn't feel authentic. We weren't really grappling with the very, very difficult problems that American healthcare had to face. It was theater, and perhaps there was more of that than there has been in the past. It's very unfortunate. It denies the public the benefit of a really authentic dialogue about very, very difficult matters.
As soon as Dr. Berwick's nomination was announced, he would be haunted by any statements he had ever made that seemed to imply he supported socialized medicine or rationing.
Regarding President Obama's nominee for the head of CMS,
comments like this, made by Kansas Senator Pat Roberts, were common.
Simply put, Dr. Berwick has a long history of very interesting statements, pertinent statements that support a government rationing of health care, an issue that I have fought against vigorously.
In 2009, you told a biotechnology journal in reference to the health care law, quote, I'm going to read it, "The decision is not whether or not we will ration care. The decision is whether we will ration care with our eyes open," unquote. Now, Republicans attacked you for this comment. Let's put it in perspective from your point of view.
Sure. The comment's been widely misinterpreted and misquoted. It actually came out of a personal experience. Prior to that interview, my daughter needed a test. I know she needed the test. I'm a pediatrician. She's my daughter. And when the test was ordered, the insurance company said, "We don't cover that test." And I went ballistic. I said, "What? How can you say you don't cover it? Who made that decision? I want to talk to the person who made the decision." Well, of course, you can't find the person that made the decision. The lights are off. That's rationing. We ration every day in this country as insurance companies make a decision about what you will get and what you will not get. That quote says, "Game over. I want the lights on. I want to know who made that decision." And they're going to continue to limit stuff. I just want to know who's doing it so I can hold them accountable for it. What happened often, and was to me symptomatic, kind of made me a little sad, was a member of Congress would attack me for something I don't believe or never said. And then I'd get a comment from a staff member, often a young person, 20-something, who would say, "Sorry we had to do that. It's not personal." First, it made me angry. What do you mean it's not personal? You're accusing me of wanting to hurt people, of rationing and all things I don't believe. That feels kind of personal. Call me incompetent, that feels kind of personal. But then beyond that, I realized here are young people in government, being trained to dissemble, to deceive, really. And no, that's not what we should be doing with people that want to, help make government better. That troubled me.
Throughout Dr. Berwick's tenure in Washington, one of his opponent's most common one-liners was that Berwick wanted the American healthcare system to be more like Great Britain's.
His views are antithetical to the views of the majority of the American people, supporting rationing as he does, his love affair with the British single-payer system, as he has described it.
Dr. Berwick had in fact worked closely with the British government to help them improve their healthcare system. Berwick says, however, that he never claimed the Brits had a perfect system, let alone one after which America's own system should be modeled. Well, one of the things that obviously hurt you, justifiably or unjustifiably, was you saying something admiring about the British system, the national health care in Britain. So let's talk about that.
Sure.
What did you say, and why did it cause you so much trouble?
Well, the organization that I started and ran for 20 years before I went to Washington was global. We tried to work on healthcare improvement all over the world, in Africa and Europe. So I had the opportunity to see a lot of different healthcare systems. None were perfect. But along that journey, I was asked by the British government to come to the UK repeatedly to help them improve the British National Health Service. There's quite a bit of problems they were having with their nationalized health system. I was asked to give the keynote address at the 60th anniversary celebration of the British National Health Service in London, and I went, and I basically said, you did something great here. You have complete coverage for your population. Bravo.
So you could have had a simpler, less ambitious, less troubled plan than the NHS. You could have had the American plan. You could have been spending 17% of your GDP to make health care unaffordable as a human right, instead of spending 9% and guaranteeing it as a human right.
But you also have some problems, and let's talk about the things you really need to work on to make it better. Well, what the opponents did is they took the first part of that speech and said that I wanted to import the British National Health Service to the U.S., which is absolutely ridiculous, absurd.
Well, I want to read you a quote from one of your opponents for confirmation. He was talking about if we go to the British system, and the quote was along the lines, if you go to that system, all you're going to have is a delay, bureaucracy. You're not going to get the kind of care you want, when you want it, from the doctor you want it. And that system simply wouldn't work here.
A government-owned, government-run system, which Britain has chosen, probably wouldn't work here. Doesn't seem to be what our people want, and it isn't connected to our legacy. But remember, this is the only Western democracy in which healthcare is not universal, in which every single person can't count on having healthcare, and we need to change that. We need to change it our way, but that's a goal that I deeply believe in.
If you've got it, watch it. If you don't, call your TV provider to get HDNet today.